Did you know there is a difference between being able to hear sounds versus being able to interpret what those sounds mean? The difference is peripheral hearing versus central auditory processing. Let's check out my handout to learn more about the difference between the two. A big thank you to my colleague Lindsay Trotter, speech language pathologist, for creating this handout. After a traumatic brain injury, like getting in a car crash or sustaining a concussion, perhaps from a sports injury, hearing loss can happen due to physical damage to the structures in your ear. Also, some people have central auditory processing challenges, CAP challenges, which result in challenges with skills like understanding speech in noisy environments. After a brain injury, people might experience tinnitus, which sounds like a buzzing or a ringing in the ears despite the absence of sound. Hyperacusis is sensitivity to everyday sounds like dogs barking, babies crying, traffic sounds, etc. Misophonia is severe sensitivity to certain sounds. Some people experience misophonia when hearing other people chew. Furthermore, concussions or brain injuries can result in vestibular challenges, which may include dizziness, vertigo, nausea, and visual impairments. Let's begin with our peripheral hearing. Sound enters into our ear, vibrates our eardrum, which causes bones behind them, the incus, malleus, and stapes, to send the vibrations into our cochlea, which is inside our inner ear. These vibrations cause the fluid in the cochlea to ripple, which causes teeny tiny hair cells in the cochlea to move. The movement of the hair cells in the cochlea sends an electrical signal to the brain, which the brain then has to process to be able to interpret what the sound is that we're hearing. Peripheral hearing loss refers to problems with the ear structures. The three types of peripheral hearing loss include sensory neural hearing loss, which is damage to the inner ear or the auditory nerve. There's conductive hearing loss, which is damage to the outer or middle ear, or people can have mixed sensory neural and conductive hearing loss. If you have any concerns about your ability to hear sounds or process sounds, go see an audiologist. Now let's talk about the central auditory system. This consists of our auditory nerve and complex pathways through the brainstem and onto the auditory cortex of the brain. After the physical vibration of sound is transduced into an electrical chemical signal in our brain, how does our brain interpret that signal? These circuits can be damaged as a result of brain injury, making it challenging for you to be able to process. So an example is if I have a brain injury and you don't, if you and I are both listening to the same conversation, you are going to be able to pick up much more information than I am because my poor turtle brain is processing information more slowly because the structures that do so are damaged. More than 50% of people with brain injury experience auditory processing difficulties. These challenges can look like difficulties knowing where sound is coming from, being able to understand speech when there is lots of background noise present, taking longer to respond in verbal conversations, frequent requests for you to repeat what you have said, inconsistent or inappropriate responding. They're answering questions that you didn't ask. Challenges keeping up with rapid rate of speech. In my Cognitive Communication Disorders, a Simplified Overview video, I made the comparison that trying to keep up with rapid speech is like trying to sprint on a treadmill with a broken leg. It's exhausting, really hard to do, and can only be done for short periods of time before my clients are too tired, symptomatic, and have to stop participating in the conversation. It becomes more challenging to follow complex or lengthy ideas. It becomes more challenging to correctly interpret tone of voice, like understanding when someone is being sarcastic or telling a joke. It is more difficult for people to pay attention to what they're listening to, and clients can become easily distracted. Importantly, central auditory processing challenges can lead to difficulties with higher order language, learning, and communication functions. In every single one of my assessments I do after a motor vehicle collision, I ask about auditory symptoms. By the time I get involved on the caseload, it means that a client is severely injured enough to require ongoing cognitive communication support. And so I'm often the first healthcare provider to screen for hearing challenges, and therefore the onus falls on me to make appropriate referrals for a comprehensive peripheral and central auditory processing evaluation with a qualified audiologist. There are several treatment approaches for people who have central auditory processing difficulties. The first kind is direct skills remediation, which is auditory training or bottom up approach. Compensatory strategies, like using planning and organizing and problem solving ideas to help compensate for your hearing challenges, is a top-down approach. And using environmental modifications, like standing away from walls to reduce reverberation. Ask for preferential seating in meetings so that you are closer to the speaker. Move to an acoustically better room, etc. For clients who have tinnitus, there are a few treatment options. There are masking devices, which, after an audiologist assesses which pitch the tinnitus is at, these masking devices can play some sort of frequency to help counteract that specific frequency that you're hearing. Counseling can help you modify your thoughts, feelings, and beliefs about your tinnitus. So this can help you change the way you think and feel about these symptoms. Tinnitus retraining therapy involves this type of counseling combined with tinnitus masking devices, or cognitive behavioral therapy with a licensed professional can help you learn coping techniques to make your tinnitus symptoms less bothersome. Other potential tinnitus treatment options include biofeedback training, which is where you monitor your own response to the tinnitus in order to gain some control of your response. Hypnotherapy introduces an altered state of consciousness to bring about subconscious change about your attitudes and beliefs about tinnitus. Myofascial trigger point therapy can release muscle contraction at certain points for clients who have chronic pain or musculoskeletal tension around the ear. Neuromodulation plays specific therapeutic sounds and sequences through a special device. Psychotherapy can help, including mindfulness training and relaxation training. Transcranial magnetic stimulation is an interesting treatment option, which uses magnetic fields to stimulate nerve cells in the brain. And vagus nerve stimulation with an electrical stimulator implanted under the skin, which is used in combination with audiotone therapy. Hyperacusis, or sensitivity to everyday sounds, has several treatment options as well. Education and counseling to the client as well as their families can help my client and their loved ones feel more in control of the symptoms. Cognitive behavioral therapy may also help to modify problem emotions, thoughts, and behaviors. Or sound therapy, which requires the patient to listen to low-level sounds for long periods of time to encourage their system to get used to being exposed to sound. Although people with hearing sensitivity want to wear hearing protection because it's more comfortable, it is not recommended when environmental sounds are safe. If you try to quiet everyday normal sounds and block them out completely, it's going to make your hearing system more sensitive to the sounds. And this increased sensitivity can actually exacerbate your hyperacusis, which is the opposite effect of what we want. However, if you are exposed to excessive noise, hearing protection is advised. Like, for example, going to a live sports game. How do these challenges impact your ability to participate in conversations? If you can't hear specific frequencies due to peripheral hearing loss, people will sound mumbled. If people sound mumbled, it's more exhausting for your brain to try to fill in the gaps based on context and keep up with the information. So you're leaking invisible activity points, and listening tasks are going to cost you that much extra points. So you'll become tired more quickly. See my video on activity points diet for more information on that. If you have challenges with central auditory processing skills, like your turtle brain moves too slowly so it takes you longer to process rapidly presented information, or if the signal is degraded at all, like if you're talking on a cell phone and you have poor reception, your brain has a harder time filling in the gaps, which again makes it that much more difficult to focus on what you're hearing, which means not all the information is even getting in. Therefore, it's going to be harder to figure out, is the information even in there? And if so, where is it? In a pile of books on the floor somewhere. There are assistive devices, programs, and strategies to help you cope with these symptoms. For more information, go consult your audiologist. And here are the sources for all of this information. Importantly, if you have challenges with keeping up with rapidly presented information or complex information, I wanted to share with you an amazing tool that may really help. First of all, instead of Googling things, my new default is to YouTube it. There are YouTube tutorials on almost anything you can think of. But the problem is, although it's nice that you can pause YouTube videos, what happens if the speaker is speaking too quickly? I have a solution for you. Hey, I know that person. I wanted to use this video as an example. First, we'll play it at its regular speed so you can see how quickly I'm talking. My name is Jessica Krapko, and I'm a speech language pathologist.
I've been working with clients with acquired brain injuries for 10 years now.
That's pretty quick. If you want to slow it down, it's super simple, just a couple of clicks. See this cog at the bottom of the YouTube video? That's settings. Click on it. See where it says playback speed? You can slow it down to 0.75, zero point 0.5, or 0.25, the normal rate. Let's see what it sounds like for each of these settings. Okay, here is 0.75.
Passion of mine, and I've spent a lot of my free time doing extra research and workshops. Some of the best course content I've come across is from Sheila McDonald. I've taken all of her short courses.
Let's see what it's like slowed down even further. This is 0.5.
This presentation is largely based off the content from that, learning how to translate what she said
Okay, maybe that's a little bit too slow. But for me, I quite often like to slow things down to 0.75. That sounds not too bad. Let's listen again.
as in her courses into real world therapy sessions. I also recommend checking out Dr. Lynn Turkstra's work.
All right, and let's compare that one more time to what normal rate sounds like.
And Mark Ilvisacker as well has excellent research in this area. Be sure to check out those original sources to get the behind the scenes information of my oversimplified version, which is coming up next.
Holy smokes, what a big difference. If you have challenges with keeping up with auditory information, I encourage you to change your playback settings to 0.75 and see if that helps you keep up with and stay interested in and absorb incoming information. And now you know about the difference between peripheral hearing, can you hear the sounds, beep, 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 loud and soft sounds, versus what is your brain doing with those sounds once they actually get inside your head. Thank you so much for your time. Go consult your local audiologist for more information. Thanks for watching and have a wonderful day.